Today in our video, we are going to discuss some basic facts and understandings of occupational health. So what is occupational health? Let us understand first. So occupational health is a branch of internal medicine and it is solely designed to prevent occupational diseases and illness and also promotes workplace health of all workers engaged in any occupation. So everybody in the world has an occupation and all occupation are having some hazards. So the basic aim of this occupational health science is to reduce or minimize the impact of hazards and to control these hazards in such a way that it will produce minimal effect on workers' health engaged in any occupation. So the definition of occupational health is the promotion and maintenance of highest level of well-being of workers in all occupation. So in short, it can be said that fitting man to his job and fitting the job to the man's requirement. So let us now understand what are those types of hazard prevailed at workplaces. Number 1 is the physical hazard. Number 2 is chemical hazards. Number 3 mechanical hazards. Number 4 biological hazards. And number 5 is the psychosocial hazards. So all those hazards are controllable and preventable, and if we control all these hazards, then there will be a very favorable outcome that there will be no occupational illness and no occupational accident and injuries also. So let us understand one by one what is physical hazards. Physical hazards are those hazards which are due to some physical agents like the radiation, the heat, noise, then dust, then electromagnetic radiation, then this ultrasonogram, the various ray, ionizing and non-ionizing radiation. Then the main physical hazards those prevailed in the workplace are heat, noise, and these radiations. Coming to chemical hazards are many types like acid, alkali, solvents, then dust, mist, fumes, and other chemical compounds used in day-to-day industrial practices. The number 3 is the mechanical hazards. Mechanical hazards are due to movement of machines and revolving part of any machines. Mechanical hazards are mostly due to running and entrapment of human body parts as a result of machine movement. It may be due to conveyor belt, it may be due to running machine, equipments and other apparatuses. The fourth one is biological hazards. Biological hazards are those hazards which arises due to presence of biological agents like bacteria, virus, fungus, then protozoa, metazoa, and other disease-causing organisms like rickettsial, chlamydias, all other infective particles. So prevailed at the workplaces like in general other general environment. The last one is psychosocial hazards. Psychosocial hazards are those hazards which arises due to defective relationship between man and man with the job and man with other stakeholders. So it is a particularly emotional and psychosocial parameters which are deranged. So it is arising due to defective associationship with human beings involved in industrial setups. So these are the hazards. So what are those hazards? In common terminology, hazards are those dangers those prevailed at workplaces, and they are having potentiality to cause ill health and occupational injuries. So controlling hazards is the main aim and purpose of this occupational health department, and this department exists in all industries, and these hazards leads to risk. Risk are nothing but the outcome of the hazards. So hazards leads to risk, and risk leads to the outcome or the disease or the injuries. So let us understand what is risk. So risks are in any form, like various type of occupational diseases and injuries. Injuries may be due to some physical, chemical, biological, mechanical or psychosocial events. So in occupational health, stresses are given to minimize the impact of hazards and thereby controlling risk and minimizing the occurrence of occupational diseases and illnesses. So now coming to those methods. What are those methods to control the risk? Those are basically three types. First is engineering control, and second one is medical control, and third one is administrative or legislative or legal control. So coming to first engineering control. Engineering controls are basically done by the engineering departments, like controlling of ventilation, temperature, then noise, then dust, radiation. This is done by many ways. First, the substitution of the material. Harmful materials or harmful raw materials and finished products are replaced by non-harmful or relatively safer alternatives. Then enclosure. Enclosing the hazards is prime important activities, like controlling the machines from a control room. Person is totally protected from the operation. And another way of engineering control is design of the building and housekeeping. If housekeeping is of best qualities, then it will minimize the exposure of dust. Also, illumination is one of the key factor. If illumination is improved in workplace, then there will be minimization of visual error, and it also results in safe workplace. So coming to medical control. Medical controls are basically based on medical examination. Before selecting a person for a job, his fitness is decided by an expert like occupational health specialist and his team. Whether his physical activities requirement is matching to his present health status or not. It is assessed by a team of experts. Some tests are being carried out like clinical examination, audiometry evaluation, spirometry evaluation, the ECG to monitor the heart condition, and other tests like vision test and the BMIs. Then periodical medical examination is also being carried out in a hazardous area. Once in a 6 month, his health condition is reassessed and stress is given whether his health condition is departed from his pre-employment status or not. Is there any deterioration of his current health status from pre-employment level? So it is recorded in a surveillance book where every 6 month health data is available for comparison. The third type of health examination is hazard specific health examination. Suppose a person is required to work at height, so height screening test is being done. Suppose a person is required to work under heat, so his urine examination, his or her urine specific gravity is assessed, and his sodium potassium level is assessed, his heart condition is monitored, and if it is found suitable, then only he is allowed to work in hot area. Then another type of medical examination is pre-retirement medical examination. So before retirement, his or her health is assessed. The worker's health, you can say, worker's health is reassessed, and it is ensured that before retiring, his health condition must be minimally departed or not departed from his pre-employment level. If any deviation is observed, some diseases or minor correctable changes are there, then it is corrected by suitable treatment or by rehabilitation and by putting on various devices. Hazard specific examinations are also being carried out in industries like lead industry, chrome industry, where daily medical examination is also required to keep an observation regarding neurological and some ulceration. In chrome industry, we need to look for chrome ulcer, and in lead industry, we need to look for lead neuropathy and anemia. So, in medical measures, there are other interventions also are required, like comparison of data, statistical analysis, and the lifestyle related problems like hypertension, diabetes, the neurological deficit disorder, or any heat related disorder are also being monitored, and suitable corrective measures are kept in place. In administrative measures, mostly they are welfare in nature. So welfare measures like 8 hours duty in a day, weekly off day, and sick leave, ESI coverage of the person for medical insurance, and social securities like PF, ESI, gratuity, pension, and disability benefit are also given on behalf of government as per Factory Act. And some welfare measures like provision of canteen, provision of restroom, provision of comfortable workplaces for employees, from giving them preventive medications like oral rehydration salts, those who are working in heat are required, and use of PPE by administrative authorities must be mandatory as a last resort of preventing occupational diseases, like using of helmet, using of nose mask, then using of heat resistant jacket, using of safety shoes, then reflecting jackets, use of ear plug, then ear muff to protect hearing, induced hearing loss are the main measures taken to prevent occupational injuries and ill health. Thank you.